Hello everyone. According to the American Lung Association, in the article Getting Help to Quit Smoking, smoking is the number one preventable cause of disease and premature death all over the world. Smoking is responsible for an overall decline in a smoker's health as it affects almost all the organs in our body. On the other hand, if you quit smoking, you can reverse the harmful effects of smoking, reduce the risk of smoking related diseases, and add years to your life. According to the article Health Effects of Cigarette Smoking on the CDC website, smoking is responsible for 480,000 deaths in the United States each year. This means 1 in every 5 deaths is caused by smoking cigarettes. Smoking increases the risk of heart disease and strokes 2 to 4 times and the risk of lung disease over 25 times. Smoking during pregnancy lead to low birth weight babies, premature babies, and even 10% of infant deaths. All these diseases that are related directly to smoking cigarettes can be prevented completely by taking initiatives to quit smoking. Today, I urge you to take this first step and fight the vice that is costing us our health. Smoking mainly affects our blood vessels and heart because nicotine can be absorbed into the blood through lungs. This causes blood vessels to constrict. Due to the narrow blood vessels, heart beats faster and harder, and the blood pressure increases. Over time, heart muscle becomes stiff and increase in size. This leads to heart failure eventually. Due to the increased pressure, blood vessels get injured over time and plaque builds up in the vessels, which leads to the formation of clots. These clots can travel to the brain and cause a stroke, or in other words, the death of the brain tissue. The next main system that is affected by smoking is our lungs. According to the information on the American Association website, cigarette smoke has over 7,000 chemicals in it, out of which 69 are known cancer-causing substances. These substances, when inhaled, damage your airways and cause mutations to the lung cells, leading to cancer. 90% of the lung cancers are caused by cigarette smoking. In other words, lung disease causes smoking, COPD, emphysema, and chronic bronchitis. These diseases gradually reduce the amount of oxygen supplied to the vital organs in our body. Due to the low supply of oxygen, tissues in the organs die, leading to a heart attack or stroke. If your health is not a big concern to you, then surely the health of your baby or your infant or your children should be. All the chemicals that are inhaled by a pregnant woman reach the baby through the bloodstream. Also, as your blood vessels are constricted due to smoking, blood supply and oxygen to the baby is reduced, which directly affects the growth and development of the baby. Smoking also results in abortions, stillbirth, premature deliveries, and infant death. Premature infants are at a very high risk for a number of health-related issues due to underdeveloped organs. Exposure to secondhand smoke during pregnancy can also affect your baby. The baby is at a great risk for developing respiratory issues, emphysema, heart disease, allergies, and even lung cancer. Babies that are exposed to secondhand smoke develop a diminished lung capacity and are at high risk for sudden infant death syndrome, or which is also known as SIDS. Now that you know how dangerous smoking can be to your and your loved one's health, it is time for you to take action and make a commitment to stop smoking. There are a lot of resources available to you through these that can be helpful to you through this difficult process. Make sure you ask your healthcare provider about providing you with these resources. Quitting is not easy due to the addictive effects of tobacco, but it is not impossible either. You have to take a step and take a first step towards regaining and maintaining your good health. Get rid of all the cigarette lighters, ashtrays, and all the cigarettes in your house. Make your house a smoke-free environment. Tell whoever is smoking around you not to smoke around you. Lower the amount of alcohol and caffeinated drinks as they increase your urge to smoke. Keep active and busy lifestyle and replace your cigarettes with something like walking. There are a lot of resource groups and outpatient clinics to support you and monitor your health. Join a counseling center or a smoking cessation group to motivate you. There are many approved medications available to help you fight the craving of smoking. Ask your doctor about which medications can be helpful or beneficial to you. Benefits of quit smoking can start within minutes of stopping. Our body has the capacity to restore itself and reverse the adverse effects of smoking. Within 20 minutes of stopping, your blood pressure comes back to normal. Within a day, the carbon monoxide in your blood comes back to normal. Within 2 to 3 months, your blood vessels become normal and circulation in your body increases. If you continue to be smoke free, within 5 years, your risk of mouth, throat, and esophageal cancers are cut to half. And if you continue that for 10 more years, your risk of lung cancers can be cut to half. Reach out to the resources in your community and speak to the cessation counselor about quitting. There are a lot of programs available by the American Lung Association, American Heart Association, and CDC that teaches skills and techniques that have been proven to help quit smoking. If you stop smoking, you can lower the risk of stroke, heart disease, and many cancers. Also, many complications of pregnancy-related smoking can be completely eradicated if pregnant women avoid smoking. Infant and childhood morbidities can also be eliminated. Quitting while you are younger will reduce your health risk more, but quitting at any age will give you years of your life back that would be lost if you continue smoking. Most of you already know that smoking is harmful for your health, but you also know that quitting can be a very big challenge. What you probably don't know is that there is a lot of help available. American Lung Association has a program called as Freedom for Smoking that offers in-person and online help for smokers. I urge you to call today and take a step or go online and reach out to this program. Take the first step to eradicate the most preventable cause of premature death. Stop smoking and live a healthier life. You can start today. Thank you.